Welcome to this edition of Incredible Health. I'm Johnny Bench, Hall of Fame catcher for the Cincinnati Reds. Today we're going to be discussing the most popular non-drug and non-surgical treatment for pain in the United States. This treatment is used by thousands of professional athletes, including me, to eliminate pain. If you have any kind of nagging pain or are looking for something to try instead of muscle relaxers and painkillers, then you better stay tuned. You're going to love this show. Don't go away. We'll be right back.
Welcome to Incredible Health, the show that interviews leading experts in all areas of healthcare. Incredible Health is informative, will help you become a more educated consumer.
Welcome back. I'm Johnny Bench. I played in the major leagues for 17 years with the Cincinnati Reds, and I've been an avid golfer for the last 40 years. And during my baseball and golfing career, I've experienced a variety of aches, pains, and injuries throughout my body, similar to some of the pains you might be experiencing right now. Look, I've seen a lot of baseball players and a lot of golfers who suffered with pain, and the best thing I've ever done to correct my pain, naturally, has been chiropractic care. Chiropractic is used by thousands of professional and Olympic athletes every day to correct pain without drugs or surgery and increases your performance. If chiropractic can help them and it can help me, then it can certainly help you too. Our host recently did an interview where she discussed why chiropractic has become so popular. Let's go hear the first part of the interview right now.
Dr. Singh, welcome to Incredible Health.
Thank you. Glad to be here.
All right, first obvious question, why did you want to become a doctor of chiropractic?
You know, that happened out of necessity, so to speak.
Right.
When I was an athlete at Ohio State, played soccer for 4 years, started all 4 years. I was real proud of that. Tell everybody that.
Yes.
And so I was going to start the very first game. And so trying to impress my coaches, I got a little overzealous in trying to do a little too much, injured my lower back, and they literally carried me over to the Student Med Center.
Ouch.
4 days before my very first game.
Wow.
And I'm thinking, I'm not going to get to play. And they said, no, don't worry about it. We'll give you some meds and see if you can get back on your feet. And
right.
if you can run, then you'll play. And so basically I did, and I played that day, scored the first goal of the season for the team. So it was a big deal for me to be able to do that, but I paid a price for that.
Right.
Because what I did was I really injured my back very seriously. So then when I graduated college, for the next 3 years, next 3 to 4 years, at least a couple of times a year, I would have a serious low back issue where I was literally flat on my back, couldn't move for a week to 2 weeks, had to miss work. So I was selling drugs at that time, legally that is,
okay.
and working for a pharmaceutical company. And a good friend of mine suggested that I go see a chiropractor. And having come from a background of health and my family, a lot of family physicians and doctors, it was like the last thing I wanted to do. But it was one of those things, you know, where you're hurting so bad and nothing's getting any better, I need to do something.
Right.
So he got me to this chiropractor. Although I was skeptic, he basically got me on my feet again, slowly but surely, got me healing. And since then, I've never had another low back issue, but he made such an impact in my life that I decided to quit my job and go to chiropractic college and move to Davenport, Iowa from Houston, Texas.
Amazing. So you've now been practicing for 22 years.
Yes.
And I'm sure in that time you've seen the rise of chiropractic care. It's certainly, you know, risen in popularity. Is that what you've experienced?
You know, I have seen that. I think back about 22 years ago, I look at the type of patients that were coming at that time to what I'm seeing now. I think what's happening in society is that people are looking for an alternative or another way other than just using drugs to cover up a symptom or cover up a problem. It's not to say drugs are wrong, it's just they aren't taking care of the problem.
Right.
And so I think 20 years ago, maybe people were not more apt to looking at other alternatives.
Right.
And I think more and more people are looking into that direction now, probably more than ever. And they're looking for a way to help themselves or find someone who can point them in the right direction so their body can start to heal better or feel better, and then maybe using less drugs along the way. Though my goal is not to say, hey, you don't need the drugs.
Right.
My goal is to work with the spine and the nervous system so that we can allow their body to heal from the inside out.
For someone that's never seen a chiropractor and might be intimidated or,
Sure.
as you say, skeptical about it, can you just briefly explain what chiropractic is?
Okay, in a nutshell, let's talk about what chiropractic really deals with. Chiropractic is an art, and it's a science, and it's also a philosophy.
Right.
It really works with and looks at your spine as the key to health and well-being.
Right.
Yeah, the brain sits up here, sends messages down to the spinal cord, and out through these little nerve endings in here to every single organ, tissue, and blood vessel in the body, including the muscles, and so forth. So during our lifetime, just living life, I mean, for me, it was a pretty serious accident. We tend to cause stressors and tension to build up on our spine. Then over time, the spine then starts to malfunction.
Yeah.
And then in turn, the nervous system starts to malfunction. And then over time, we start ending up with some problems, maybe an ache or a pain, maybe a headache, maybe some tightness into our shoulders, maybe even some stomach problems from those alignment issues where the nerve just doesn't get the message properly to that part of the body.
Right.
And also down primarily to the lower back too, because let's face it, a lot more people come in with lower back issues. They don't think about the spine for stomach problems or headaches or neck pain, and etc.
Right. What does it feel like to be adjusted by a chiropractor? I think a lot of people might be afraid of, oh, is it going to hurt, or am I going to be jarred in some way?
Sure. That's an excellent question. So let me pick up one of these guys
Sure.
and take a look at what would happen. When the spine is not in its proper motion, and sometimes there's lack of motion, or it may be not in its proper position, that can cause the stress on the nerve. So you just have to gently get that information into the nervous system and the spine to allow that process to unfold. So you don't really need a lot of force to try to apply that. People think that you're going to have to jump off a chair onto your back. And movies do a great job of looking at how chiropractors adjust. And I know I was at a couple of movies where people are going, oh, and cringing because that's not exactly how it's done.
Yeah.
It's a very gentle force applied to get the nervous system and the bone back in its proper position so then the nervous system can function well, so then healing can occur. It's very gentle, and most patients in my office actually say, that really didn't hurt, and boy, that was very mild. I thought you were going to crunch on me.
Yeah. Can you talk briefly about the computerized testing that you do in your office for your patients?
Sure. I have a couple of things that I use. I use a digital scanner because we look at the structure from the feet up to the top. We look and see how your feet are aligned. And the other one I use is what's called a wind posture. The wind posture basically is a piece of apparatus that looks at how well your nervous system is functioning. After all, chiropractors deal with the nervous system. And so what it allows us to do is to see if the nervous system is working correctly or is working incorrectly. Now we have a tool to tell us and let us know if that's the case or not.
Doctor, I do have to take a break. We're going to hear a little bit more from Johnny Bench, but I also want to mention that you do also offer a free consultation, so why wouldn't somebody want to come and see you, right?
Absolutely.
Yeah.
I would agree.
Awesome. All right, we're going to hear a little bit more from Johnny Bench. Stay with us. Incredible Health. We'll be right back.
If you are suffering with any type of pain and are looking for a natural way to correct it without using medications or surgery, then you need to call the number at the bottom of the screen and make an appointment for a checkup. Doctors of chiropractic have special training at treating most types of pain in your body. When we come back from our break, we will talk about what kinds of pains can be caused by misaligned vertebra, and we will continue to talk about why chiropractic has become the most popular non-surgical treatment for pain in the country. We'll be right back.
As a former collegiate athlete who's had numerous injuries, I am a big supporter of chiropractic and have used chiropractic for the last 20 years. Let me share with you my experience just in the last 3 months. First, I had a foot injury about 3 months ago that had been nagging me for about a good 6 months. And it wasn't a normal sprained ankle type of injury. It was kind of a pain that was shooting across most of the bones on the front of my foot. And I remember in a casual conversation in a social setting telling my chiropractor that I really think I'm going to need to have surgery. And when he heard that, he said, "What are you doing?" And he said, "Come here, let me fix you and let me help you." And it took literally about 5 minutes. And within 15 minutes, I'm not kidding you, 15 minutes, 90% of my pain and discomfort that I had experienced for the previous 6 months was totally gone. And within about 2 or 3 days, I had 100% no pain. I felt totally fine, and it just blew my mind. The second thing that happened, which was about 2 months ago, is I had a terrible shoulder injury. I was in the gym working out, and I dropped a weight kind of off to the side, and I thought I tore my shoulder.